One of the many problems with our healthcare system is the overwhelming disparities of certain racial and ethnic communities.
Is there a noticeable difference between patient to patient? And probably not from patient to patient. But when you look at large numbers, which is what we're dealing with in public health, it's not just the individual patient, but it's the entire patient population. When you look at the entire patient population, that's when you start to see the differences in care start to play out. So on a one-to-one, comparing apples to apples, you may not see the differences, but on a larger scale, when you look at aggregates of patients, is when you start to see the differences in care.
We have a lot of students that are pre-registered, so I have an idea of where they're coming from. We've had a lot of feedback through our website and through Facebook, so we know that this is actually a service that is really desired to learn about the fundamentals of applying to medical school and what it's like to be a physician. So I'm just excited to actually stand and talk to the students one-on-one.
Extremely excited, very nervous. It's difficult because this is something we've been trying to do for 6 years, and the fact that we're on the cusp of actually doing it brings a lot of anxiety to come along with it, because we want to make sure we pull off a good product.
Thank you for welcoming us to our last stop on the Tour for Diversity in Medicine.
Junior year is when you really need to be studying for your MD.
I want you to look at the person to the left of you, and then look at the person to the right of you. Now, 30 years ago in medical school, they used to say, the person sitting next to you, one of the people sitting next to you is not going to graduate from medical school. How does that make you feel? Horrible, depressing, a little sad, saying it ain't going to be me? Yeah. All right. Now let's try this again. Look to your left. Look at the person to your left. Now look at the person to your right. The person sitting next to you could discover the cure for cancer.
Now is a great time to develop that, because just walking around the college campus, even your instructors even, like these are people who can take you places.
The person sitting next to you will discover the cure for AIDS.
So, since the loss of electrons, the number should be going down, not up. So that means I'm going to eliminate C, and B is going to be my answer.
The person sitting next to you will save your mother's life, or will deliver your baby, or will be your child's pediatrician.
That timeline is constructed for how to get through in 4 years, but if you need extra years, especially for these extra degrees, take the time.
That's what we're here for today. We're here to make sure that you all become our colleagues in medicine, and that you all are the caregivers that our community so desperately need.
And for dental, it's the dental admissions test, so the DAT. Again, these are going to be things that little by little you get a chance to understand.
What other HBCU would you go to if you didn't have the opportunity to go to yours?
You have the body, you have the transverse process, you have the spinous process.
You can stay with the student, you can see how they live, you can see what they do for fun.
You take an oath, and you just keep moving, and people will react to you the way that you react to them.
It's a Tour of Diversity, it really gets you a head start in the medical school. And being a freshman just coming in, I really wanted to get my head start now.
I've been thinking about obstetrics and gynecology, helping young women.
First and foremost, I'm here because I want to be a doctor, not just a black doctor.
What to do, the strength of my application, MCAT.
There's been a lot of hints given out, there's been a lot of insights that I wouldn't know beforehand prior to getting into this.
Getting in physician shadowing, because I haven't done that yet.
A lot of times you hear about medical school and the tasks, it seems so daunting. But when you actually talk to people who've made it through who are in school, they're not too far from you.
Mentoring too, because there's not many professors here that are willing to do that role.
This is a once-in-a-lifetime experience.